All right. Hi, everyone. Welcome to another edition of 10 Minutes with JPIDS. I'm Ravi Jhaveri, your editor-in-chief. And I'm really pleased today to be joined by my Lurie colleague, Dr. Merie Heffernan. Hi, Marie.
Hi, thanks for having me.
Thanks for being here. Maria is one of our recent authors, and we're going to talk a little bit about survey-based research. But as our listeners out there know, I start every episode with origin story. I'm a superhero nerd and proud of it. Uh, if you could tell us a little bit about how you got involved in qualitative survey-based research.
Yes, happy to. So I went to grad school for social and personality psychology, and one of the primary methodologies used in that field, especially in personality psych, is survey methods as a way to study individual differences. So, how extroverted or introverted a person is, how conscientious someone is. So surveys are used very frequently. One of the first projects that I worked on in grad school was taking a longer survey, so a survey that was about 40 items, and using factor analytic techniques to reduce the length of the survey to only 9 items, because then we were able to administer the survey to the same person kind of repeatedly about different people in their lives, because it was an attachment survey. So that made that possible. And so ever since then, I have been doing survey research in one way or another. Fast forward to when I started at Lurie Children's about 7 years ago. I launched a survey of Chicago parents called the Voices of Child Health in Chicago. And that was a survey that we surveyed parents 6 times over several years about all kinds of topics related to child, adolescent, and family health. And since then, I've done lots of other survey work with folks from all across the institution. One of the cool things about having surveys in your tool belt of tools that you can use is that it's kind of topic agnostic. So you can use it to study all kinds of things and to get parent and family perspectives on a lot of different things related to child and adolescent health.
I love it. Thanks so much for sharing that. We're going to come back to that last point in just a sec. For our listeners, I wanted to just share a little bit about how we actually came to invite you to contribute this piece. We were discussing a paper that was submitted to JPIDS about survey-based research. I can't remember the topic, and I couldn't share it anyway. But but the point was we got into the discussion of many journals sort of having a sort of flat threshold for survey rates, and below a certain point, they just won't even consider it. And amongst the associate editor group, we just were debating that we thought that that was really far too rigid, and that depending on the groups you were talking about, if you were surveying the general public versus a very specific motivated group on a listserv on a niche topic, that you shouldn't just say everybody, like 70% of people need to respond, that it's far too rigid. And so we said, well, we need to get somebody who knows more about this than we do. And so the first person I thought of was you. So that's how we got to this point. So um, coming back to the point you just made, which was about sort of um, engaging and using survey methodology, can you just talk about how, I mean, as someone who has not been involved in survey methodology before, I feel like the the field has grown, our tools have grown a lot, and so I feel like we're seeing more survey-based research. Am I wrong about that, or is that actually what's happening?
I I think you are right about that. I don't know of exact numbers of survey research that's coming out, oh, if that has increased, but it seems reasonable to expect that that has increased largely with the introduction of internet-based survey
Yeah.
methods, which really changed the landscape of survey methodology.
And then in terms of the other point that you were sort of making about how survey questions sort of add a richness to people's research, can you just talk about how researchers can think about doing that? What are some of the steps that they can undertake to add survey questions and a survey perspective to their work?
Absolutely. I think child health researchers in many disciplines can benefit from incorporating surveys in their work. One way that I think about this is that it helps to elevate the perspectives of community, of patients, of families, caregivers, that are often perspectives that are overlooked in child health research, child health policy. And so giving that voice more volume, I think, is really important to do. And there are steps people can take if you're starting out with survey research and you've never surveyed your population of interest before, um, that can help you kind of identify what kinds of questions should I even be asking. So you might start with some more qualitative research methods, like doing some qualitative interviews of the population that you're interested in,
Hmm.
that will help you just have a broad picture and of people's experiences in X, Y, or Z. And that might help a researcher to identify, like, oh, here's an issue that's preventing folks from coming into the clinic. I should ask questions more about that topic. So that can help you kind of narrow the field of questions that you might be considering asking. Another thing that I think is a really good idea to do for folks who are, considering surveying for the first time is to look to see what else has been done. Or is there a validated scale out there already? Are there like NIH promise tools in the toolbox
Hmm.
to identify if there are validated scales out there already, so that you're not trying to reinvent the wheel? Because there's a lot of additional steps that go into launching a survey de novo that has never been administered before. So if you can find examples out there that are related to the topic that you're interested in, I think that can be really helpful.
Awesome. And then, I know you discussed it in the paper, so I don't want to completely spoil it, but I do just want to ask you to maybe give us a little bit of a teaser about your thoughts about the survey rates and how they vary from different populations that are being surveyed.
Yeah. So survey response rates are the number of participants in general, the number of participants who completed a survey divided by the potential participants who were invited to take that survey. And there is some nuance to that, kind of depends on how you think about whether everyone who was invited to the survey was eligible, and whether you have corrections for potential cases of ineligibility. Researchers are typically aiming for high response rates, like you mentioned, partly because that's a prerequisite sometimes for publishing in high impact journals, and because it can signal a low response rate can signal that the sample might potentially be biased, that those folks who completed the survey are systematically different than the folks who did not complete the survey. But one of the challenges with response rates is that researchers can calculate them differently, and that you should expect different response rates depending on the specific survey methodology that you're using. So if you're recruiting from a patient cohort that your research team has a relationship with already, you'd expect a higher response rate than if you were cold emailing a random sample of patient families from the hospital, for instance. So I think taking into account the context of the specific research methodology that is used is really important for making judgments about, is this response rate acceptable or not. In my work, a lot of the time, I'm pretty happy if I'm at around a 30% response rate,
Hmm.
but one size does not fit all. And so that could be really high, could be really low, and it really depends on the specific methodology that's being used.
Yeah. And it may, I mean, people don't really talk about maybe the opposite side, which is that researchers sometimes might game the system to have an artificially high response rate that in and of itself isn't a broad enough survey of a population, right?
Yep, yep, yeah, I think that is true.
Um, and so maybe the last question I just wanted to ask you is, at this point, we as sort of citizens get surveyed about everything, where we ate, the where we work, the last survey we took and how we felt about that survey. Like, is survey fatigue a real thing? And if yes, how do we sort of break through so that people will answer our survey, even if
Yes.
they're fatigued?
Oh, yes. So I think this is an empirical question that we don't yet have a solid answer to. There has been some work, a study that was done looking at folks who completed or did not complete the 2020 census. And if they had been surveyed or recruited to also complete another national survey, the American Community Survey, in the years preceding the 2020 census, and they found lower response rates for those folks who had completed the ACS, American Community Survey, than those who did not for the census. Um, but I think that's a little bit different than what people are talking about when they're talking about survey fatigue, because it's exactly what you said. If I'm getting a survey invitation to complete a survey from my kid's school, and then another one from my institution, and then another one about a doctor's appointment satisfaction, you can expect that people might feel fatigued or overwhelmed by the number of invitations or the number of surveys that they've taken. And I don't think we have a solid answer for that yet. But I think you're right that there are, if you buy shoes online, you might get a satisfaction survey afterwards. And so I think that's a real concern. And I think it'd be a great topic for future researchers to explore in terms of how do you make your survey stand out and get people to, click on the link and hopefully complete the survey. I think keeping invitations short and sweet to the extent possible, because often there's like required language from the institutional review board, but keeping invitations as short and sweet as possible, and similarly keeping the surveys themselves short and sweet, and making sure that the language that's used in the survey is simple and not at all confusing, and having the survey cover what you needed to cover and no more,
Yeah.
because the longer it is, the more likely people are to get distracted halfway through, to say, I don't have time for this, and then fall off the survey, and so they don't complete it.
Okay. So no one's going to do a long survey about survey fatigue. That's a bad formula.
Yes, so that
Okay.
one, that might not be a winning one.
Okay. All right. Well, Dr. Merie Heffernan, I really appreciate you joining us today. I hope everyone gets as much out of this article as we on the editorial team did. Appreciate your contribution to JPIDS. And before we sign off, I just want to give a shout out to Kayla Moore, who's our editor and producer for this podcast. We really appreciate it. It doesn't go without Kayla. So, Kayla, thanks very much. And we'll see everyone next time. Take care.
Thanks so much.